Infertility can be an incredibly challenging experience, and the treatment itself can also be quite stressful. And so what we know is it's really important as we navigate these ups and downs that we keep in mind your mental health and we think of all the important coping strategies to help us get to that goal. And just using the resources that you do have available, each other, potentially at the practice you're seeing, acupuncture, yoga, meditation. There's no one way to manage stress. It's really what's best for you. When couples are going through infertility, it's incredibly important to have an open and honest conversation. First and foremost, as I always say with my patients, it's not her fault or his fault. We are all on the same team. It is that collaborative approach. And I think what I've heard from patients is it's challenging. It's challenging when you particularly are the patient or you're the partner. And how do we both be able to be seen in this complex experience? And how do you see each other? So it starts with the basics. It starts with talking to each other. And then also knowing if it could be helpful to be guided by somebody else, such as a psychologist or a therapist, and helping you talk to each other, that you utilize that resource. We know how incredibly important it is for people to be able to talk about the emotional ups and downs of infertility. Not because it's the cause, but because it's the effect. And our goal is for you to stay in treatment until you're able to be successful. So if therapy is what speaks to you, I would not hesitate. I think what is so hard about infertility is it's literally like 1,000 report cards before the report card that matters. It's everything. It's the first test, it's the first ultrasound, and then you're going through the IVF cycle, and you haven't even gotten to the pregnancy test, and it's draining. And so probably in all aspects of our life, but particularly in infertility and recurrent loss, I think it's so important that we're present. For a lot of people, infertility and recurrent loss creates a lot of guilt. There's this sense when you ask, well-intentioned friends and family that it's our fault, that you could simply go on vacation and you could conceive. But if you think about the comparator, if you had a family member who shared with you they had heart disease or they have Crohn's disease, nobody would suggest to them to go on vacation. So it's equally nonsensical to suggest that to someone who's an infertility patient. If you haven't yet identified a physician, I strongly recommend that you reach out to an infertility physician so that you get the best care. It is not one size fits all. Again, for some it's therapy, for some it's Peloton. We just want to find what it is for you so we can help you get to that goal in the least painful way as possible.